Hello everyone, this is 16th MCQ. In a stem of MCQ, a 3 years old male child present with fatigue, pale skin and shortness of breath on exertion. Mother said child also eating the mud and chalk, means the history of pica is present. Child's diet consists mainly of milk and dairy product. Physical examination reveals severe pallor of the palpebral, conjunctiva and palm sole. Lab investigation revealed hemoglobin 4.5 gram per dl, means severe anemia. Serum ferritin 7 nanogram per ml, again it is significantly low. And MCV, mean corpuscular volume 65 femtoliter, means child is having severe microcytic anemia. Now the peripheral blood film. So here in this blood film you can see all the red blood cells are microcytic and hypochromic. So what is the most likely cause of the child's anemia? So see the options. All four options: copper deficiency, iron deficiency, lead poisoning and thalassemia intermediate. All four are the causes of microcytic hypochromic anemia. So according to the history part, child is having history of pica and consuming mainly milk and milk product. So mostly iron deficiency anemia. But when child is consuming the mud or chalk or pencil or any other part, it can lead to the lead poisoning also. But in lead poisoning, basophilic stippling of the RBC will be visible. So it is not here. So according to the history and this part, patient is suffering from severe iron deficiency anemia. Now what are the dietary history suggests the cause of anemia? So learning points are, whenever in history they mention cow milk diet, milk based diet, bottle feed, poor weaning food, you should suspect iron deficiency anemia. History of pica is characteristic for the iron deficiency, means altered appetite for the mud, chalk, pencil, color, raw food items. We label as a geophasia if eating the mud, phagophasia or amylophasia if eating the other item. Example, sometimes child is also eating the ice or other product which are not uh, edible products. So altered appetite we label as a pica. It is significantly suggests patient is having iron deficiency anemia. Only in this anemia history of pica is seen. If consuming goat milk diet, then it can lead to the folate deficiency. If in history they suggest that child is consuming the goat milk and MCV is macrocytic more than 100 femtoliter and serum folic acid level less than 3 nanogram per ml, that means folate deficiency. If child is strict vegetarian, even not consuming the milk product, pure vegan, then vitamin B12 deficiency can also lead to the macrocytic anemia, megaloblastic anemia. So according to the dietary history, you can get the which nutritional deficiency lead to the anemia. So what is the difference in the iron deficiency and lead poisoning? Because both are microcytic anemia. So in lead poisoning and in iron deficiency, in both, free erythrocyte protoporphyrin FEP level will be elevated in both anemia. But coarse basophilic stippling of RBC is seen only in the lead poisoning. Here you can see the basophilic stippling is present in the RBC. It is characteristic of lead poisoning. If such blood film they are giving in the MCQ, you should suspect the lead poisoning. Elevated blood, lead and urine coproporphyrin level are seen in the lead poisoning. Thank you so much.